I'd like to introduce our first speaker, Mia Keeys. Mia is the Director of Global Health and Innovation at Hologic, Inc., a global medical innovation and women's health company. Formerly, Mia was Chief of Staff and Health Policy Advisor to Congresswoman Robin Kelly, with whom she wrote the first comprehensive maternal health legislation in congressional history, the Mamas Act, in 2017. Later, Mia became the inaugural Health Equity Policy and Advocacy Director of the American Medical Association's Center for Health Equity. She's also been a public researcher in South Africa and a U.S. Fulbright Fellow in Indonesia, where she worked with young people and their families for 3 years while learning the language. The National Minority Equality Forum recognizes Mia as a 40 under 40 leader in minority health. She holds a Master's of Arts degree in medical sociology from Vanderbilt University, where she was a Robert Woods Johnson Foundation Health Policy Fellow through Meharry Medical College. She's now a doctoral candidate at George Washington University. Her dissertation is on health equity, policy, and artificial intelligence, all very important topics in our time. She's also a published creative nonfiction writer with training from the University of Oxford. Mia lives in DC, but as you see, she is very much a global citizen. She serves as a commissioner for women, and she has one lovely son. So Mia, I'll give it over to you.
Thank you, Ingrid, and thank you so much for having me here today. I'm so excited to be present for this fellowship. I've heard so much about your gatherings, and I admire everything that you and your team stand for, Ingrid, and I'm really looking forward to just sharing a bit about myself. I had a lot of fun just putting these slides together, mostly because I'm into vibrancy, and I think we all need a bit of color and just joy in our lives, especially because we're living in a time where our optimism really does have to fuel our passions and our resilience, and also the work that we're doing. Many of you come from so many different places physically, and you come at your approach in life from various intersectional identities, politically, racially, gender-wise, race, and so forth, religion. But I think the one thing that really we all hold in common is if we're not here pursuing what we need to be pursuing, what we're called to do, then we won't feel fulfilled in life. And so I think there's a way to do that, and I call that my algorithm on living, loving, and learning. So people often ask me, where am I from? And I think many people, it's different when people say, and many of you have had this question, well, where are you from? And then you try and explain, and people are like, well, no, where are you from? I'm originally from Philadelphia. I'm a Philly girl. And that means a lot to me in terms of how I view the world from a perspective of having grown up in an urban environment, as well as in a suburban environment. I grew up also on the outskirts of Philly. And what that means when I go into the world. How are people interacting with one another? What does it mean to have access to proper fruits and vegetables and safe spaces to play? What does community mean? All of this is really very much grounded in how I grew up. And for many of you who have been to Philadelphia or have lived in urban cities around the world, you've probably had similar concentrated thoughts on what does it mean to be neighborly? What does it mean to be a part of some sort of civic cause? Or who do you see yourself in terms of how you show up in your world? And your first world was certainly your home, and your home was constructed based on your socio-eco environment. And if you haven't asked yourself those questions, hopefully that's what I've just mentioned to you generates some sort of questions for yourself. All right, so I after a very interesting childhood, I stayed in the area for college. I attended Cheney University. It's the first historically Black university in the world, founded in 1837, and obviously this was before the abolition of slavery, and I had an incredible collegiate career. I did a lot of work academically, just showing up there. I think many of us are used to a certain level of performance academically. in terms of like an external focus on success. But I must say that it was really these very formidable experiences that I had at college that changed me internally and has forever cemented what I view as a significant part of me in terms of, again, how I show up and how I engage, not just in my local community, but how I show up in the world. And my first foray into that was really at Cheney. So I had the opportunity to be appointed as Miss Cheney University. That's the picture of me and these, gentlemen clothed in their gold, and they're adorned with their jewelry here. This was a ceremony based on a West African matriarchal type of ceremony. That was the theme of my coronation, and was based on my time that I spent in Ghana, and specifically in Accra and in Kumasi. When I was in college, I had the opportunity to study abroad there and this is one of my favorite pictures of that time, just being with some young folk and enjoying them in their academic setting, and just exchanging stories of what it means to be a learner. And we had a lot of fun doing that. I also, and service is probably going to be a theme in terms of what I talk about, I'm a member of Delta Sigma Theta Sorority Incorporated, and just about a month ago, we celebrated our 112th year of existence here in the world. And for those of you who are unfamiliar with Panhellenic organizations, there are 9 of them, or the Divine Nine. We all pretty much stand for the same thing, but for me, sisterhood, scholarship, and service, again, is a major theme in terms of how I show up in this world. So that's the academic-y stuff. Where did I go and where have I been? So after college, I moved to DC, to Washington, DC, to pursue some work on the congressional level. I was a Barbara Jordan Health Policy Scholar, as Ingrid mentioned, and that taught me so much. This was in 2008. So for those of you who can place where you were in time, not just in space physically, but where you were in time, at least in the US, there was and really actually globally, there was a major recession. There was a lot happening in terms of policies being put in place that ultimately scared a lot of people, because this was the time when ICE was formed. This was the time when a lot of banks foreclosed. So people were facing not only foreclosures on their home, but a lot of people were scared to answer their doors because they were thinking that they might potentially be arrested and sent back to their home countries if they've come to seek refuge in the United States. And so I worked with the city of Philadelphia in a health capacity, in a public health capacity, as their immigrant health and language access coordinator, to basically look at the needs of people across the city and say, okay, irrespective of where you come from, but especially if you come from places outside of the United States, what are those barriers to care that prevent you from presenting for a flu shot, that prevent you from going to a library? Maybe, again, because there's fear, because there's a lack of information, because maybe someone's not speaking the language or writing in the language of your preferred listening and speaking and writing tongue. So that was an eye-opening experience for me. I then came and so that was back in Philadelphia after I left DC. But then at that point, I had a congressional experience under my belt. And by the way, this was the time when Romney Care was the conversation. And for those who are not familiar completely with the history of our national healthcare system as it exists today, it's based upon what we colloquially called Romney Care. And this was a space where the ACA was being born, basically. So that was my first foray into public health policy, and then brought that back to back to Philadelphia. So I said to myself, I've got congressional, I've got a local idea of what it means to insert policies and understand policies' impact on people's lives. I wanted to go global, and through different relationships. I'm going to come back to this all the time. Service and relationship, these are part of my algorithm. I was able to leverage a position to work for an organization called Love Life. It's an HIV and AIDS advocacy organization based in Johannesburg, but has presence all throughout South Africa. And I traveled the nation for a relatively short time, about 7.5 months, just working with young people and their grandparents primarily, because many of them had lost their parents to HIV/AIDS related complications over the year. I worked with the born free generation. These were the generation of folk who were born post-apartheid, which is a whole nother conversation in terms of what that means socially. So I spent a lot of time just trying to understand, again, similar questions. What are those social, ecological determinants, because that language wasn't necessarily being used completely yet, that were impacting people's ability to present for care, and to essentially make decisions that optimize their well-being. And again, a lot of listening, a lot of learning, not even just actual new languages, but literal ways of communicating with others. I then, after some years, or excuse me, after some time, moved to Indonesia, where I was initially a Fulbright Fellow in a very rural area, and working with young folk in an educational setting. But I ended up staying for ultimately 3.5 years in Indonesia. Lived in various places, mostly in Jakarta, the capital, working with young people and their families on hard conversations, basically holding hard conversations through academic settings. So what does race mean in a global setting, and specifically in Southeast Asia, and more specifically in Indonesia? What does it mean when we're having conversations about race and gender and sexuality in a space that doesn't have a national consciousness, or at least especially at that time, about those issues? So lots of, again, I cannot emphasize how my relationships and my really ability to just sit back and listen and learn and then share with others. That was really my pathway. That was my algorithm. I then moved to Nashville, which is actually where I am now, ironically enough, just for a few days right now. But I came to Nashville to attend Vanderbilt University to study what was then a PhD program in medical sociology, and it was a dual program between Vanderbilt and Meharry. The short history there is that Vandy and Meharry live in Nashville, which is a major civil rights city for young folk, which again matters in terms of where I was showing up in my space academically. And I can answer questions about that if anyone is curious. But I ended up leaving my doctoral program at the time because I wanted to, in 2016, when there was a pending transition politically, I wanted to really get back to DC, be a part of that policy world. I could bring my experiences. I knew I had a unique outlook based on all the spaces where I spent. By the way, I completely forgot to mention that I went to England. I didn't. I forgot to mention that. Long story short, I'm also a creative writer, and I wanted some training in that, so I took time to do that. But anyway, I moved back to DC to pursue work in Congress, where I was appointed as the health policy advisor to a member of Congress who provides health policy advice to an entire caucus of people, the Congressional Black Caucus. So I was in charge of the counsel to that caucus, health-wise. And then I spent some time just doing various things in DC. I was the health policy advisor, as I mentioned. I was the caucus policy director for the Congressional Black Caucus. I helped to stand up the American Medical Association Center for Health Equity, which in all of its nearly 200 years had never been a focus. And this was right when COVID hit, or right before COVID hit. And so I'm really proud of being a part of that inaugural leadership team. Then I went back to the Congresswoman's office for whom I worked to serve as her chief of staff. At that time, I also was becoming a mother, so various transitions in my life, a solo parent, frankly. And then I moved for mostly so that I can give myself space and time to adjust to early motherhood and other opportunities, to the space where I am now at Hologic, which is a medical technical company focused on women's health. And in this capacity, I was initially a lobbyist, helping to convey stories with respect to women's health and innovation to Congress, where I had just come from. But now I sit in a more global space, and I serve as the director of global health and innovation for Hologic, which is why I'm here today. I have to deliver a presentation later on today for a medical association with respect to global health. So I think I just have a few more slides I want to share with you, and then I'd love to just hear some things from you all. So these are just some scenes from some of the research I was able to do in spaces I was able to be a part of in South Africa, some in KZN, some spaces on the Cape, some spaces just elsewhere. These are some scenes from my time in Indonesia. I had long hair at the time. As you can see, I've cut off all my hair since these forays. And these are some pictures from my time in in England in Oxford, which was somewhat of a departure from all the other spaces where I spent time. I spent a lot of time in previous spaces just outputting, and this was a time where I really spent time just honing my craft and spending a lot of internal time creating. So that was really important. And these are just scenes from the various schools where I've spent time. This is the congresswoman for whom I worked, Robin Kelly. These were some of my some cohort members of the space that took me back to DC initially. This is a page of a book that I helped to co-write on equity with respect to health policy and also racism in the US, but from a global perspective. And I'll wrap up here. These are just some things that I've learned consistently, irrespective of where you go. Be kind and be able to rely on the kindness of strangers. Really trust that. That'll take you far. Be curious. For the same reasons that you never know where the best lesson or the hardest lesson that you'll learn or the most pivotal lesson that you'll learn will come from because of your ability to be open to the experience. Be of service, especially because there's no greater, I would purport, there's no greater sense of fulfillment than being a part of something bigger than yourself, even if no one sees it, and especially if no one sees it. And then finally, be mindful of your social ties. Take care of your relationships. Be neighborly in the space where I think COVID especially showed us that if your neighbor's not well, you certainly won't be in time. And so these are just some, I would say, algorithmic pathways, especially because I spend a lot of time in the AI space and innovation space. But these are my takeaways there, and I'd love to hear your feedback. And finally, I'd say that here in the U.S., it's Black History Month. Although I tend to think about it from a diasporic perspective, and it really does my heart well to be able to be a part of this conversation and to hear from you all and to share my story, because someone has done this for me, and others do this for me consistently. And for me, I think about the West African Principality of Sankofa, which is basically reach back and take someone with you. Because especially people are always doing that to me. And so I think that that's a principle that I've been able to think about as I've been invited into this space. So thank you so much for your time.